Well, good afternoon, everybody, and welcome to the second of our 3 dialogue events on COVID-19. These 3 events have been co-organised by the British Council and by the Science and Innovation Network of the UK's Foreign, Commonwealth and Development Office. My name is Susan Watts and I will be moderating this evening's discussions. I'm a science journalist by background. I worked at the Newsnight Current Affairs programme of the BBC for nearly 20 years and now work in strategic science communications. Our first dialogue was focused on the subject of vaccines against COVID-19, and our subject this evening is how to communicate data in a pandemic. Again, this feels remarkably prescient, at least here in the UK, where this week we heard on Monday that our lockdown process is going to be lifted over the next few weeks and months, but will be driven by data, not dates. So data has become very important to all of our lives. So tonight we're going to explore many aspects of data. We're going to look at data literacy in the population, how journalists and communicators deal with data as they reach their audiences. And we're going to look at some of the best examples of getting that right in terms of public data dashboards, perhaps, and how we might do better in the future by listening to best practice from elsewhere, gathering the right data in the first place, and making sure that we store that in a way that's very manageable and usable. So we're very excited to present to you our keynote speaker and later to convene our special roundtable scientific discussion, for which we'll be joined by experts in their field from Bulgaria, the Czech Republic, from Greece, Poland, Romania and Slovenia. We have one housekeeping note. Professor Ladislav Ducek is no longer able to join us tonight, but his colleague Andrew Majek has very kindly agreed to step in and take his place, and we are very grateful to him for that. So just a rough idea of the format for this evening: we will have an introductory talk, then our keynote talk, and then our roundtable discussion. And that discussion has 2 elements to it. First of all 6 speakers will introduce themselves and tell you a little bit about their work and perhaps reflect a little on the talk that they've heard. And then we will have half an hour of maybe a slightly more interactive discussion and questions amongst our roundtable speakers, and then plenty of time for questions, half an hour or so at the end of the event for questions from yourselves, the audience. And just to say that you'll probably see a Q&A, hopefully a Q&A button, and if you could just pop your questions in there in that chat, my colleagues will be collating those questions carefully together and clustering them for me, and I can then ask the appropriate people in that question section at the end of the event. So first, I'm very happy to introduce Professor Carole Mundell. Now, Carole is Chief International Science Envoy at the UK's Foreign, Commonwealth and Development Office. She's a Professor of Extragalactic Astronomy and Head of Astrophysics at the University of Bath and a Fellow at the Institute of Physics. Carole is going to tell us a little bit more about the use of data in a pandemic from the UK perspective, and from her point of view as one of the team of scientists who's been funneling in advice to our government here in the UK during this past year of the pandemic. So thank you, Carole.
Thank you, Susan, and hello everybody. It's great to see you all, and welcome back to those who tuned into our first event in these very exciting science and innovation dialogues. And I think in that first dialogue we saw some of the rich complexity of the discussion around COVID-19, and particularly the frontier work done by our scientists in the vaccine space, all the way through to logistics and engineering. So it's a fantastic discussion. And as Susan introduced, tonight we're going to discuss a different aspect of dealing with this pandemic. And in particular around data. So I'm not a virologist, I'm actually an astrophysicist, and I'm a data scientist by background. But of course, data are not information. Information is not knowledge, and knowledge is not wisdom. So I hope that tonight we'll be able to draw along that pipeline. And I'm particularly pleased to welcome our keynote speaker, Professor Spiegelhalter, who will shortly discuss with you the huge responsibility that the holders of data in all their form, scientists of course, but also government and journalists together, the responsibility we all have in communicating and interpreting those data, and in fact gathering and in some case creating those data from the frontiers of our scientific methods. Governments and scientific committees across the world have recognised this challenge in terms of putting data-based evidence at the heart of their policy making. But of course, it's a really complex thing to do. And in the pandemic, of course, getting this right is absolutely vital. We work at the frontiers of uncertainty. We're doing this at pace, and it affects not only people's livelihoods, but actually people's lives. And so the importance of this work and the pressure under which that work has to be done well can't be overstated. And of course, methods we've seen around the world have varied depending on different people's cultures and approaches to those data and the capacity that they have to gather those data, along with metadata and all of the other understanding that has to go with the curation of data sets and the sharing of them. The way in which the UK government speaks with the public is not the model for governments everywhere, and there are approaches and means of doing this that I think we can learn from one another, particularly through this past year and reflecting on what's worked and what hasn't. And that's really the heart of what we're here to discuss today, that sharing of knowledge and best practice and how we can do better as we go into the future. In the UK, we have in place a systematic communication mechanism between scientists, the government and public. This is a very long-standing science advice mechanism. It's formalised in a mechanism called the Science Advisory Group for Emergencies, and this is a mechanism that is stood up to support Sir Patrick Vallance, who is the government chief scientific advisor, to give him the best possible science advice when he has to draw across a very complex emergency in order to give advice to the Prime Minister for a complex emergency. And of course, the COVID crisis is such a complex emergency. So SAGE was scrambled back in January last year when we first heard about this unusual virus that was emerging in Wuhan in China. And it's been unusual because normally SAGE is convened, the advice is gathered, the consensus is reached, and the advice is given through to policymakers to then formulate the policy advice to our ministers and our cabinet. But of course, for COVID, this is a long-standing crisis, and so we've actually stood up a dedicated COVID-19 SAGE that has been working throughout the last now 13 months. It is co-chaired by our Government Chief Scientific Advisor and also our Chief Medical Officer, Professor Chris Whitty, both of whom are distinguished career scientists, and you will have seen them flanking our Prime Minister and ministers on the daily calls if you've been watching on the BBC or perhaps other channels. So SAGE's advice draws from a wide range of expertise. We have a core group and we have many subgroups that are working and feeding in to the main advisory group. We have expert knowledge from everything from across the virology research landscape through to modelling the disease course, understanding the clinical picture, and also understanding the social psychology and the effects of compliance and interventions on our society. Drawing this together in a consensus-based way is really a way to put together the descriptors around uncertainties and helping our ministers to understand what we know, what we don't know, what we're doing to learn more, and what we might learn in the future. This advice then is used by our government ministers to allow them to make the best possible decisions and to inform the government's response on this outbreak, and also to look forward and also to look to see what kind of systematic logistics that we need to put in place in terms of an infrastructure perspective. As Susan mentioned, we have a COVID dashboard on the .gov.uk website, and that's been constantly updated as we've learned more as we've gone through this pandemic. And we've also been working closely with the domestic press to deliver key messages to the public on the epidemiological situation and the government measures as clearly and transparently as we possibly can at pace. Particularly useful have been our efforts to break down data by region. The Office for National Statistics is a gold standard in terms of an arm's length body that helps us to do that, and really understanding not just the pandemic as a global sense, but actually right down to regions, right down to street by street level has been really important for helping us understand the boots on the ground epidemiological picture. And of course, representing complex scientific information isn't always easy, and we certainly don't always get this right. But what we've been keen to do through this pandemic is to make sure that communication with the public is as clear and transparent as possible. And so we were able to give our journalists direct access to the scientific experts for them to ask all of the questions that were important for them to communicate clearly with their stakeholders. We also think this is critically important to get right because, of course, we are working against the presence of direct disinformation, so deliberate misrepresentation of the situation, and that's a growing problem that I know countries around the world are trying to tackle. This undermines our public health efforts to try to protect our populations and try to resolve this epidemic. It's an issue that we take extremely seriously, and it's a very complex issue as well, and so we're working at pace with partners to combat false and misleading narratives about the coronavirus and ensure that the public has the right information so that they can make the right choices to protect themselves. To this aim, we've created a new counter-disinformation unit, bringing together expert teams to help to provide a comprehensive picture on the potential extent, scope and impact of the disinformation on coronavirus in the UK. And that's something that we're also very happy to share with countries around the world. This again is a new form of data, a new way of analysing the impact of such misinformation and false and misleading claims. The disinformation is a challenge for countries around the globe, as I said, and we've therefore provided £500,000 for additional UK aid for the Humanitarian to Humanitarian Network to help countries to tackle this, particularly around Southeast Asia and Africa, and to directly get the right kind of information to people to help them to tackle this in their own lives. And of course, underpinning all of this is the importance of international dialogue, which is why I'm particularly pleased to have so many people represented around our roundtable tonight through transparency and collaboration, helping one another to share data, because together we'll have a much more complete picture of this pandemic if we're able to do this at pace and accurately. And I would like to acknowledge the excellent work of COG UK. This is the UK consortium for genetics, which has really sequenced 200,000 genomes upwards and led the way in the COVID-19 genomic analysis and surveillance. All of those genomes are made publicly available for scientists around the world to access. And without the work of that network, we would not have been able to identify, track, and therefore control the spread of new variants. So it's fantastic to see that COG UK are transparently sharing their expertise globally and hopefully helping other countries raise this kind of genomic surveillance capacity in their own communities. We're also grateful to China for having actually put out the original genome sequence very early on in the pandemic. That was incredibly important for scientists around the world to start to work on vaccines and therapeutics and also tests. In 2020, in December, in the UK, we notified the World Health Organization of the identification of a new variant of concern that was emerging in the UK. And this was really important that we were transparent about this, and we're glad to see other countries have followed our example there. And I've been watching very carefully and with great admiration for the scientific efforts that have gone in not only to identify that variant, but to track its spread and to understand its impact and the epidemiology of that variant, as well as helping our vaccine developers to understand whether and how to adapt their vaccines to respond to that where necessary. This is a situation that will be ongoing, and we will have to continue to increase our surveillance and make sure that our data systems come together to make sure that we can protect our populations in the coming months and years. So in conclusion, I've seen some wonderful science, wonderful things brought together. We've learned a lot in the UK, and I think we have an incredible infrastructure now around our data systems. We approach this with some humility. We know it's an incredibly complex space and we need to continue to improve it and get it right. And I have to really pay tribute to our experts, some of whom we have on the call tonight, for their ongoing, absolutely tireless efforts to get this right, and also to help the communication of the work that we're doing behind the scenes to our public so that they can understand the robustness with which we are doing this work to protect their health and their lives in the future. So together, I think we can do better. We will have to do better. We'll have to look at the future of pandemics and make sure that we are never in this situation again. But I think tonight's dialogue will be very rich in contributing to that. So thank you so much for your attention. I wish you all a wonderful debate and discussion tonight. Thank you.
Thank you very much, Carole, and a lot of really interesting points there to pick up perhaps later on. Especially I noted the counter disinformation unit might be something that people would like to pick up on, transparency and the importance of international dialogue. So now it is time to hear from our keynote speaker. So Professor Sir David Spiegelhalter is chair of the Winton Centre for Risk and Evidence Communication at the University of Cambridge, which aims to improve the way that statistical evidence is used by health professionals, patients, lawyers and judges, media and policymakers. As you can imagine, he's been very busy over the COVID crisis. A former president of the Royal Statistical Society, David has become a familiar voice to many of us and a voice of reason in our broadcasting media here in the UK. In recent years, he has presented a number of television documentaries and written a couple of award-winning books, no less. The book on climate change by numbers, and in 2019, a bestseller called The Art of Statistics. So I'm delighted now to ask Professor Spiegelholter to address us on how to communicate data in a pandemic. Now you're muted, David.
Right.
There we are.
You'd think after a year of this, I would have learned to unmute myself, but never mind. That's
Sorry.
it goes.
Happens to the best of us.
No, it always happens to me. Anyway, great pleasure to be invited to speak to this group. A big honour. I'm feeling very intimidated because I'm a statistician. I started off as a mathematician. I'm surrounded by real scientists who actually know something about science and pandemics and viruses, and I know nothing about those. But I do work on data, and in particular, I work on the communication of data. I am, I'm afraid, going to talk mainly about, well, I'm going to talk about what's happened in the UK. I'm going to be, my messages will be mixed. I'm going to point at some good work, but I'm also going to be quite critical as well of what has happened in the UK. I'm not going to say it's all been wonderful at all. I think there's room for a lot of improvement. So, but I'm now going to attempt, I hope I'm going to share my screen. I hope this is going to work and that someone will let me know if that's not working. So if that's working, can you nod your head, Sarah, and then I'll know. Can you see my first slide? Cool.
Yes.
Right. Okay. So that's me. I should point out down there it says non-executive director of the UK Statistics Authority. I started doing that during the pandemic. So that means that I'm kind of on the board. I'm on the board of the body that oversees the entire statistical system for the UK. And that includes the Office for National Statistics, the independent, well, reasonably independent statistics body, but also the Office for Statistics Regulation that regulates statistics, and also the whole government statistical service. So I have got some role in that way. Okay, so just a brief background to me. I used to be a proper statistician doing mathematical research in medical statistics and so on, and I did that for most of my career. But then I was lucky that in 2007 I changed direction and went into statistical communication, essentially, through being philanthropically funded. I was very lucky, which meant that I could go on to CNN and make documentaries and so on. And now I work with a curious group of people. They don't always look like that, but a curious group of people, the Winton Centre for Risk and Evidence Communication. It's in the maths department in Cambridge, but it's full up with psychologists and web designers, social scientists, professional communicators from the BBC and so on. So I now actually work on the research of communicating in an appropriate way, and that's what I'd like to come on to. As you said, I got a book. The pandemic is a good opportunity to sell statistics books, I've got to be honest. Okay, so the first thing I want to say, and it's already been mentioned in a way, that data does not speak for itself. In my book, I've got a quote by Nate Silver, who wrote The Signal and the Noise. The numbers have no way of speaking for themselves. We speak for them. We imbue them with meaning. And that's what I'd like to emphasize throughout this talk, that numbers are always embedded in a context, in a narrative, in a story. And I know I could make any number look big or small, frightening, reassuring. I can do it. And but what I want to talk about is the fact that we have to be careful in how we communicate numbers and help people understand them. So just some points I'm going to make. It's been a very busy time. I'd say that generally, national statistics organizations have done a fantastic job throughout the world in trying to get the data out, changed all their practices, the way they communicate. They've really risen to the challenge. For statisticians, been a huge demand from the media for comments from experts, from scientists and so on. In the UK, we're lucky, we've got a science media centre that acts as a sort of intermediary between the scientists and the media, and that enables us to, actually the scientists to have a very, very prominent role in radio and on television and in newspapers, where there's constant demand. Most journalists have acted well. Yeah, not bad. You know, some are not so good. So there's been some excellent data journalism from different places. One thing I would say that might come up in the discussion is, as a scientist, it's very difficult to remain non-aligned. The media always want you to blame somebody. They want you to speculate as to what should happen. They want you to say what should be done. And if you're just trying to explain the science, it's quite difficult to avoid that, because you're constantly being asked to go outside your area of expertise. And I think that's something we all have had to face. Just saying, no, I don't know, you'll have to ask somebody else. So that's what the point. Okay, let's just look at some data and how some of the data is being communicated. This is from yesterday. So this is the latest data from the UK from yesterday, released by the Office for National Statistics. And it shows over the period of the epidemic, the number of deaths registered each week. The blue are the COVID, green and non-COVID, and the black line is the 5-year average. I could give an entire lecture just on that graph, but I'd like to point out a few things from it in terms of the communication. First, note that there's some explanation actually given on the graph. Saying bank holidays affected registrations. Because of national holidays, there's a dip in registrations because the registration office wasn't open. And so you get these dips, which are pure just due to the fact that there are public holidays, that bumpiness. The other thing is the title of the graph is the story in the graph. And that's quite an innovation, I think, for a national statistics organization. So they say deaths not involving COVID-19 were below the 5-year average in week 6. Now, what that's saying is if we look at the first peak, the first wave, there's quite a lot of green above the black line. So that were deaths, non-COVID deaths were excess. So those are excess deaths. Now, we now think those are probably were COVID deaths, but people weren't being tested. Elderly were dying, not being tested. These were COVID deaths. But now there's a lot of blue. We can blow up that last bit. There's a lot of blue below the black line. That means that there's more COVID deaths than there are excess deaths over the 5-year average. People are not dying of other things. And of course, that raises the whole issue of why, how much of a lot of this will be because there's no flu, because the measures are sufficient to stop flu, but also because many of those people will have died earlier in the year. So there's all sorts of interpretations that this generates, all sorts of questions that this generates. And then we can dig deeper. This is again a graph from yesterday, looking at where people were dying, the excess deaths over the 5-year average in the different places where people die. Now, a huge story here is down in this left-hand corner, looking at what's happening to people at home. There's nearly 50% extra deaths are happening at home, more than about 1,400 a week. Now, 400 of those are COVID, but 1,000 deaths a week, extra non-COVID deaths happening in homes. So that raises the whole question again, what's the quality of these deaths? Is this a good thing or a bad thing? So always the data just generate more questions that we want more research and studies to identify. But notice a couple of things, the use of small multiples of the same pattern of the graph with the same axes in a grid, very powerful way to communicate. The Office for National Statistics uses this extensively by different regions and so on, because the eye is very good at identifying differences between these graphs. So we're seeing two things there, a number of innovations, the labeling of graphs, the explanation on the graph, the title having an interpretation, and the use of small multiples, all being used now. And these are all innovations, they weren't being used before. Okay, let's look at our dashboard, our national dashboard, which is mentioned. It goes up every day. I'll only show some of it, and it just shows the current estimate of R, the broad patterns of people testing positive, of deaths within 28 days, patients admitted to hospital, and virus tested conducted. A few bits of explanation. They just show, this just really shows the shape of the graph. This band is where you shouldn't believe the data because it's still going to be updated, and so on. And there's a broad summary of what's happened. So this is just, if we look on deaths, we can see there's 3 different graphs given for deaths, because you know, what is a COVID death? At least 3 different, I can think of 6 different definitions, but there are 3 being used on our dashboard. The first one is deaths within 28 days of a positive death by the date at which people actually died. And so this is quite a smooth curve, but this isn't what's reported every day. What we get reported every day is how many deaths have been reported in the last 24 hours. In other words, this graph is what is reported by the dashboard at 4 o'clock every afternoon, and then goes onto the national news. This is one of the worst bits of data communication that I know. I have got angry every single day for an entire year almost because of this number. The media are obsessed by this because it's news. 4 p.m, a new number. And it comes out. Look at the spikes on it. It's always high on Tuesdays and Wednesdays, and it's always low on Sundays and Mondays. And so you can't believe any of those things. It's vaguely reliable Thursday, Fridays, and Saturdays, and the people still have not grasped this. So this is deeply annoying. And I never look at this. I just look at this graph, which necessarily is going to be updated, but is more accurate. But that, of course, is not what we should be looking at. We should be looking at what's on the death certificate, because that's the reliable data. And this is also given. And this is even more out of date in a way, because all these is likely to be updated. But this is the actual, in a way, gold standard number for how many people die involving COVID. That's the most reliable data we can look at. So in a way, I feel sorry for the media having to deal with the fact there's 3 different definitions of COVID deaths that are being reported. And we can think of a lot more, because this doesn't even start looking at excess deaths, which I think is the best measure to look at completely. Okay, what about, I'm moving on now. What about trust? It is absolutely vital, and you know, in a population to trust. Well, we would like to be trusted. Now, we should not want to be trusted. I've learned this from a philosopher, Honora O'Neill, who's a philosopher of Kant, and she's had a huge influence in our country as a sort of a roll your sleeves up working philosopher. And she comes up with some wonderfully simple summaries. She says, for example, that organizations should not be aiming to increase trust. We shouldn't say we want to be trusted. What we should do, remember, she's a philosopher of Kant, duty ethics. We have a duty to demonstrate trustworthiness. The responsibility is ours to be trustworthy. Then, if people want to trust us, that's good. But the #1 priority is to be trustworthy. I find this enormously powerful. It's been very influential. In the UK, we have a code of practice of statistics issued by the UK Statistics Authority, of which I am now a director. And its #1 pillar is trustworthiness. And that's been influenced by this philosopher. So we're always asking about, are the statistics trustworthy? Now, I'd like to, this is Boris Johnson, of course, and there's been lots of statistics that have been given out at the daily briefings. They have got better, but I would like just to show a very brief clip of me on the national news last May complaining about the way that statistics were being reported at these briefings. And so I hope this is going to work, but here I am having having what I might call a rant, having getting it off my chest.
So now I'm very familiar with these daily press briefings. How well are they working, do you think?
Well, I watched yesterday's, and frankly, I found it completely embarrassing. We get told lots of big numbers, imprecise numbers of tests being done, 96,878. Well, that's not how many were done yesterday. That includes people that were posted out, tests that were posted out. We're told 31,587 people have died. No, they haven't. It's far more than that. So I think this is, actually not the trustworthy communication of statistics. And it's such a missed opportunity. There's the public out there who are broadly very supportive of the measures. They're hungry for details, for facts, for genuine information, and yet they get fed this, what I call number theatre, which seems to be coordinated really much more by, you know, a number 10 communications team rather than genuinely trying to inform people about what's going on. I just wish that the data was being brought together and presented by people who really knew its strengths and limitations and could treat the audience with some respect.
You're now very
Okay, that's me getting angry, really, and at what I feel is some very bad communication that's been done. It has improved. Things have improved, not because of me, I don't think, but it does show, I think, that as scientists we may not want to be able to want to tell people what to do or what policy there should be. I do feel we have a responsibility to call out publicly when we feel that the public are not being communicated to in an appropriate way. Okay, so just to finish off now, I'd like to point to some examples again of where I think, you know, some very good lessons we can learn. And I quite like lists. I do like lists, I'm afraid. So we're going to get some lists, I'm sorry. This is what I call the Krebs List. This is Lord Krebs. He was chair of the UK Food Standards Agency through multiple crises. The poor man, he had foot and mouth, he had BSE, he had scrapie, he had everything, one after the other just thrown at him. And he developed a checklist, which I use all the time, and you can see other people using it. It's very simple. We've already heard really some of this as well. First of all, say to the public what you know. You know, we do know a lot. Then you say what you don't know. You are open and have that humility to admit what you don't know. And then you say what we're going to do to find out, what extra work we're going to do. And then you can tell people what they should do in the meantime, wear a mask, do all this stuff to be on the safe side. And then, crucially, tell them that things will change. We will learn more, we will change. And it's, I mean, this is happening maybe a bit more now in this country, but in the past there's been, you know, I think many politicians have communicated in a way, just say, we know best, and this is what we're going to do. And then they've had to change their mind, and it's been very bad. So I find this a very useful list to refer to. Okay, so part of demonstrating trustworthiness is to admit uncertainty, as John Krebs said. And that might mean putting a range around a number where we can. But it's more than that. It's more than just putting a confidence interval, because we have to admit when we just don't know very much, when the evidence is not very good. We have to be public, I think, and open about admitting a limited quality of evidence. And I'd like to point to some people who are quite good at doing that, lessons we can learn from other organizations. The climate change, IPCC, are good at doing that. In the UK, we've got an extremely good network of what's called What Works centres that look at policies in every area and evaluate them to look at what works. I think they're brilliant, massive. I'm so proud of these. And they've all developed, they've realised that they have to communicate the quality of the underlying evidence. So if we look at in education, you can look at this, you can go up to it. There's a dashboard there, and you can look at different education interventions that you might want to do, a headmaster might want to do, and it scores them. It's like TripAdvisor. This is a TripAdvisor for government policies, and it scores them according to how much they cost. Here we've got an intervention, aspiration interventions, trying to get kids to aim higher. Well, this seems to be quite expensive. It doesn't seem to work. The months of impact doesn't seem to have an impact. And the evidence is very poor. Whereas collaborative learning, you know, working together as teams, it's fairly cheap. It seems to have a big impact on educational achievement, and there's good evidence about it because of the studies that have been done. Now, this is very powerful to say how quality the evidence is. And we've heard about SAGE operating, who produce recommendations, and when they produce a recommendation, they sometimes put an interval on the effect it might have on R, and they give the quality of the underlying evidence, their confidence in their conclusion. And so face coverings outdoors, which we don't have to wear in the UK, they say very low impact, and they got high confidence. It's not going to make any difference if people wear face coverings outdoors. Closure of places of worship, of churches and other places, they think it might reduce R by up to 0.1, so they give an interval, but then they only got moderate confidence in that, and they're not very confident in that analysis. And I think this is very powerful, again, to have that public humility. So they put all their findings, all their claims on a scale from low confidence, low to moderate, moderate, moderate to high, and high. I think this is brilliant. Okay, just finishing off now. We've also got some rules. I've got a Nature paper. And I try to score when everyone's trying to communicate about evidence or about a scientific claim. I score them according to this. Are they trying to inform rather than persuade me? Are they really genuinely interested in informing me? Are they giving a balance between the benefits and the harms, the winners and the losers? Are they being open about the uncertainties? Are they talking about the quality of evidence? And we might come to this. Are they dealing with misinformation? We'll come back to this. It's so important to get in there and preemptively hit the misinformation hard. Get in there and correct it even before people hear it, maybe. Okay, so just to finish, be careful speaking to the media. Yeah, we got to be careful. I was on the radio program. This is the main radio program before Christmas, talking about Christmas rules. I said that raised voices could spread the virus. I'm in a choir and we couldn't, well, we ended up being able to sing outdoors with masks. So maybe singing could be banned over Christmas, but I also said maybe they should ban family arguments, because then if people are shouting at each other, that's going to be very dangerous. This was a joke, but within an hour, the newspaper had this headline: families could be banned from arguing to prevent COVID spread, says a leading British statistician. So I'm really proud of that. I hope Sarah appreciates that bit of media impact there. I'm really proud of getting that story into the newspaper. That's one of my proudest achievements. So just to conclude, I think data literacy, I hope we might talk about, is a vital skill in modern life. The COVID crisis has made this even clearer, a huge importance for people to have an understanding of the scientific process and in data in particular. And just speaking completely on behalf of my profession, I think statisticians have done pretty well, and they've not had strong agendas apart from their belief in that data should be treated with respect and the public should be treated with respect. Okay, so I'm going to stop there. I hope I was vaguely on time. And that's me.
Thank you very much, David. Yes, you were perfectly on time, and a very interesting talk. Lots to pick up on. I think you're being a little bit modest about the impact of what you say actually on policy. I'm not sure that you did manage to ban arguments at Christmas dinners, probably not there. But I do think you mentioned last May your little rant there about the quality of data, and I think you are absolutely right. I'm glad to hear you say that you think things have improved in the last 9-10 months or so, because I think they have. I can't resist one question. I know on Monday you were again on the radio on the Today programme asking about more detailed information on vaccine rollout. Have you had a response yet, or are you still anticipating that?
Yeah, that was. I don't have an argument very often, but I did have an argument then, because I said that our current vaccine data, we've got a fantastic rollout program, but the data being made available to the public is very, very poor at the moment. We're not getting the detail about areas, by different groups, by different age groups, by ethnicity, all that detail that which should be in the public domain. And in spite of the Stats Authority asking for that a month ago. I think they interviewed the minister immediately later that day and asked him about what I said. And so, yeah, things I think should be moving. They should be moving. Not just because of me, but I did want to go public on that. I thought that was so I only might do this kind of thing very rarely, and then try to go in there hard. Yeah.
Excellent. Well, that we'll await the answer on that one then. Yeah. So now, as I say, thank you to David, and it is now time to move on to our roundtable section of the evening. And for this, we're joined by 6 experts in their field. And what I'm going to do now is invite each of the 6 speakers in turn to tell us a little bit about their own work. And then we're going to move on to a more general discussion between all of our experts and keynote speaker. And then, of course, time for your questions. And I'm hoping you're leaving any question you may have in the Q&A section on your screens. So our first roundtable speaker is Florina Bojin. And Florina is Associate Professor at the Victor Babes University of Medicine and Pharmacy in Romania. She's also coordinator of the Genomics and Molecular Biology Department of Oncogen, which is a centre for gene and cellular therapies in cancer. So Florina, over to you now.
Hello, it's very nice to be invited in this roundtable about communication. And just seeing the presentation, I realized that just doing my regular job, actually I follow the rules of good data communication, which means that as a teacher, I inform the medical students about the number, and the number of the medical students in our university is around 1,000. So around 1,000 students were informed related to immunological processes, because I'm an immunology teacher, and I informed them about the immune response in viral infection, and then particularly about SARS-CoV-2 infection, and then even when this virus was named Wuhan or novel coronavirus I suppose in March or something like that. And then I told them about the diseases, and then I had to balance all this information so that all the scientific data will be intelligible for them, will be accessible, of course, and for sure would be usable for them, because they were very scared. Even the medical students were scared about this disease, and everybody around them was scared. So imagine that just informing 1,000 students, then they informed their parents or their relatives, and so the community of people which were received good information was, I suppose, okay. So as this was about my job as a teacher, but of course I'm a researcher, and I'm coordinating this genomic department in Winton Centre, and as a genomic department coordinator, we didn't perform, but we analyzed the sequencing of the SARS-CoV-2 genome, and we just published and communicating the information about sequencing to the scientific community in Romania. And also we communicated all the scientific information about COVID and novel vaccination strategy that we developed, and so on, also to the scientific community in Romania. So this is what I did so far in this part of communicating data to others. Thank you.
Thank you, Florina. That's a very good introduction. And now we know a little bit about your role. And our next roundtable speaker is Andrzej Fal, who is Dean of the Collegium Medicum at the Cardinal Wyszynski University and head of the Department of Allergy, Lung Diseases and Internal Diseases at the Central Clinical Hospital in Warsaw in Poland. He's also been president of the Polish Society of Public Health for the past 7 years. So, Andrzej, if you'd like to tell us a little about your work.
Thank you so much for this kind introduction. First of all, David, thank you so much for your talk. I felt so much better after listening to you, because before our meeting I thought, well, what I'm gonna say. I feel so bad with this 10:30 in Poland, because you're 4 p.m. with announcing the official data everywhere. Every day it's called 10:30 in the morning in Poland. So every single day we have this, no matter Sunday or Monday, we have all the same data, also with the same change that you've been pointing, that it's lower on Sunday and Monday, and it's much higher in the middle of a week. But every day we are getting excited, and talking heads on the TV have the job to do until the very, very late evening, just to squeeze the data and go around them. So thank you. I feel so much better that it's not only something wrong with the Polish communication of data, but it's like ubiquitous. The second day I'm really grateful for is the journalist approach, because, well, I know that you have to give the data straightforward and you have to comment on them with the best of your knowledge and your best of your abilities. But sometimes when you talk to journalists, especially when it's a as a meeting 2-on-1 or something, they wouldn't stop asking questions until they reach some point when they have big news. The big news hit the screen at this point, because data by itself is not big news. But, well, I just said a word too much. I just said, okay, it could be a disaster. Well, the Prime Minister could have been wrong, and this was the one word too much, and this is the power, and this is what. Well, but sorry, this is only the comment on your absolutely excellent talk. But I'd like to add up to this discussion we're having about the communication of data, because I have a feeling that we're focusing mainly on communication of numerical data. But first of all, at least to my experience during the pandemics, we needed to communicate some other data. At the beginning, let's say on July, August last year, when we are just thinking of having some vaccines ready and helping us to fight the pandemics, we made a couple of tests in Poland, and we knew that only 27 up to 30% of people, of the citizens here in my country, were willing to take the vaccines, whatever they would be and whenever they would appear. So at that point we said, okay, why is that? And we decided to start giving the information publicly. I mean a group of 13 or 14 scientists who decided to write down a handbook in a plain language, understandable to junior high school graduates. So we did, and I think that, well, not only because of our initiative, but there were several such initiatives in Poland and elsewhere. So thanks to these initiatives, now we can say that we have 65 to 70% people willing to get an injection, willing to get vaccinated, even though there are no vaccines available, but this is another story. But I think that the plain communication and the good comments on data given publicly on the role of vaccination, on what the virus is or not, or is not, what the technology this or that, we have different technologies in vaccines, so why this is good and why the other is good as well. I think that communicating of these data made a great switch, at least in Poland, from being uncertain and not willing to get vaccinated to being waiting and willing to be vaccinated as soon as possible. And now for the last comment on this level, coming back to the numerical data. I think that straight communication is very important, of course. But first of all, you need to make a decision which data you're going to communicate. Because, well, when you're saying, okay, I communicate for the whole government, for the whole country as a supervising statistician, a chief statistician, this is another story. But when you speak to well, some audience, you know, well, maybe 10,000 people are listening to you, or you are in a presentation or in a talk to students and you have 300 of listeners. But, well, these are medical students, so they're expecting another level of data. So to get credibility, you need to choose extra strains of data with extra comments to have them interested, and they will understand this. As opposed to the strains and comments you need to choose, well, speaking on a TV program or whichever, when you advise to, well, to many listeners, you don't even know how many of them and who they are. So you need to be very careful, in my opinion. You need to be very careful not to use data that will not be fully understood, even if they are important. But if by any chance they could be misunderstood by your public, it's better to withhold, in my opinion, and not to, well, share this data with comments if you're not sure that you'll do it in a way that will really leave the audience with what you intend to, and not you just, you know, make a mistake and start people thinking that something is hidden, that we have a second bottom or something. So thanks for the beginning. Once again, the excellent, well, both introduction were excellent. Thank you guys for that.
Thank you, Andrzej. And David's probably burning to come in on that last point about which data you should present to which audience. But perhaps, David, if you can jot down your thoughts on that, we'll come back when we get to the discussion. But lots of interesting points there. Misinformation has come up again, and how to combat that. So we're just going to move on now to our third roundtable speaker, so that everybody has a chance to be introduced. And our third speaker is Ivan Ivanov. And he is from Bulgaria's National Centre of Infectious and Parasitic Diseases, the National Reference Laboratory for Control and Monitoring of Antibiotic Resistance, and has a broad background in molecular biology, microbiology, and genetics. So, Ivan.
Hello, thank you very much for being able to participate in this really important webinar. As I've been introduced, I'm associate professor in microbiology. My group is responsible for collecting data and analyzing data on antimicrobials used in the country, their use, and the level of antimicrobial resistance that we are facing in the country, collecting, analyzing, and reporting it to the European Centre for Control and for Prevention and Control. This is my main field of work, but currently, as we all know, we are part-time doing different jobs related to COVID-19, and my other job now is to support the sequencing team, because I have quite a experience on sequencing different bacterial genomes and data. So now with my colleagues, we are facing a lot of sequencing information, and these data, our current problems are related to analyze the massive data that we obtain from the genome, and to associate this data with the patient information in a way that is really manageable to all the systems and users of this data. So that is why I'm here and learning a lot from this webinar.
Thank you very much, Ivan. So making data manageable might be a theme there to pick up. So our fourth roundtable speaker is Gikas Magiokinis. Apologies if I've mispronounced that. And Gikas is Professor of Hygiene and Epidemiology and Scientific Coordinator at the National Reference Centre for Retroviruses in the Department of Hygiene, Epidemiology and Medical Statistics at the University of Athens in Greece. Gikas, over to you.
Hello, and thank you for the opportunity to participate in this excellent roundtable. So I will just take 2 minutes to discuss about what I'm doing. I'm a member of the committee consulting the government for the COVID-19 pandemic, and also since last September I am briefing about the current epidemiological situation in the world and the Greek situation, the Greek epidemic, through the national network. That used to be like 2 or 3 times a week, but now it's once a week. I'm being grilled every Friday by the public. Now, that was partially because I have a love for communicating science. Probably that came to me when I was back in the UK. I used to be in the UK in the Department of Zoology at the University of Oxford. and there was a tradition about communicating science. So the info is that I used to occupy the office that Professor Dawkins had. So probably there was a metaphysical transfer of this love for science. I think from my experience, one of the major challenges for communicating to the people is I think the policy behind closure of different activities, and that has been very difficult in Greece, especially about school closure, as data were coming in and out, like the children are driving or the children are not driving the epidemic, and then we had the variants, and I think this is a major challenge that we faced, and we were trying to convince people that things are not the same as the flu epidemic, or it's a different epidemic, and I think that deserves some discussion, if possible, like what is how we can use the data, because there are many uncertainties around the data, and we were trying to do our best. That's what people are trying to do through this pandemic. They are trying to make the best possible decisions based on data that, as you say, sometimes are not very clear. So thank you very much, and I'm looking forward for a discussion.
Thank you, Gikas, and certainly we'll come back to the issue there you raised, very important one about school closures and whether it's safe to return. I like your reference to Professor Richard Dawkins' office. For those of you who don't know, he was probably our first professor of public understanding of science, I think, or certainly early on in that process in the UK. Moving on now to our fifth roundtable speaker, and our fifth speaker is standing in for Ladislav Dušek, and we're very grateful to introduce Andrew Majek, who is head of International Department at the Institute of Health Information and Statistics for the Czech Republic. Andrew.
Thank you very much for introduction, Susan, and I'm very grateful and very excited to be here, actually. And in my short talk, I'd like to shortly describe what we are doing as the Institute of Health Information and Statistics of the Czech Republic. So it's a statistical body, not a policy-making or decision-making body, and this is the thing sometimes quite difficult to communicate, actually. And I used to work mainly in epidemiology and management of non-communicable diseases, but that changed a lot a year ago, as did change the work of our institute. The good news was that we had a really good legal background and technical background, but the bad news was that still a lot of things needed to be developed in quite a short time. And just as an example, the COVID patient or COVID infected individual, that was a completely new entity in the system, starting with lab, cooperation with public health authorities, cooperation with hospital, all of them different actors that could actually contribute to the data collection. And we really needed to introduce completely new paradigm of data collection in very short time. And that was quite a big challenge for the data collection body as ours. But that was not enough to actually know about the patients with COVID that are there. But again, new paradigm was introducing actually real-time monitoring of health system capacities, which is also often not the case within national statistical information systems. And of course, it was not enough to look back, but we also needed to look forward for the decision makers on the municipal and region level, and also for the coordinators of the acute care. We needed to provide some projections of what is going to happen with the capacities in a near future. And of course, this is extra difficult also to communicate, because there are so many inherent uncertainties that this is extra communication challenge. But there are more challenges, and I would say that the biggest one is actually a lot of expectations from different stakeholders, and these may really include different part of policy making, ministries, legislators, public health offices, regional and municipal authorities actually, but also communication with journalists and public, and actually their expectation to have different kinds of products and types of information is really high. Just an example of a web portal we have developed within the Institute of Health Information and Statistics, really having a lot of data inside, but again, the big challenge is to actually explain all the data, all the uncertainties, all the pitfalls of the data that are presented, because people always want to know a lot of data, but as was very nicely stated, data do not speak for themselves, and the precise communication and understandings of all the risk is difficult. Just one final note, what was also very important for the communication, namely with scientists and data journalists, was making a lot of those data actually available to wider public, because really the public seems to be eager to have those data set available in most details possible. But again, there needs to be some trade-off between, let's say, confidence of data, but also confidence in the data and the information then carry, and the risk in the interpretation. So thank you very much once more for being here, and also thanks very much to Professor Spiegelhalter for an excellent overview of all the pitfalls, which I can very much relate to.
Thank you very much, Andrew. And now we'll hear from our final speaker of our 6 roundtable speakers. And this is Maja Pohar-Pelme, who is Professor of Biostatistics at the University of Ljubljana. She is head of the Institute of Biostatistics and Medical Informatics at the Medical Faculty. She is very involved in developing statistical education and science in Slovenia, and is head of the only Slovene master's level program in statistics. As a statistician, she is the co-editor of the Slovenian Medical Journal. Maja.
Thank you, and thank you very much for having me here. Yes, I'm a statistician, so I do not have the expert knowledge the other speakers have, but of course I'm very interested in the data and the way they're presented. Now, I'm not from any governmental organization. I come from a university, and what we typically do in our lives is we consult to researchers in medicine. We help them analyze the data, and we also do a lot of statistical methodological research. Now, of course, when the pandemic started, we were very interested in what is going on, and but the usual thing didn't happen. The usual thing being that researchers in medicine would contact us and ask us for our help. We are the largest, or pretty much the only real biostatistics department, medical statistics department in our country. So we were hoping to use our expertise, even if we were not really doing research in infectious diseases. We were more non-infectious disease epidemiology, sorry. But the situation in Slovenia was that the medical doctors, the researchers, were far too busy doing day-to-day organization of work to be interested in data. And the organizations that one would expect would do that were also really not able to pick it up. So what happened in Slovenia was that let's say volunteer project arose, which is called COVID-19 Tracker, and we joined them happily, trying to help with our expertise. And this is now the best, largest, basically only source of information, a web portal with all the information. So it's been a little bit the other way around. So they are now getting the data from the official sources and then trying to present the data in a way that is interesting for the public and also for the decision makers. So we've turned the story a little bit around. So we are trying to be a part of that group. In our institute, we're also trying to develop epidemiological models. We're trying to adapt the methodology to the Slovene specifics of the data. Of course, this also means that we then have to explain our results. So we do have quite a bit of contact also with the media, with the decision makers, trying to show them what we found out, what we could learn from the past, do better in the future, what data we are missing, what we would need to answer certain questions, and so on. And I've been very interested in what the other speakers were saying. We've really, of course, come across pretty much the same problems, all of us. I think one problem that we do have here in Slovenia is that there is no really good communication. I think a lot of the data that are daily reported depends on the strategies behind, right? So, for example, how are deaths measured, as David talked about, the definitions of something that gets measured, but also more like what is in daily media is the daily new cases reported. Okay, this is a number that has a lot of problems, and the problem is that when presenting that number, we have to have really a lot of knowledge about the strategies of testing. Who gets testing? Why do they get tested? Which tests they get tested with, and so on and so forth. And without that information, of course, whatever beautiful graph you put out is pretty useless. So that's one thing. And the other thing that I would say that I really liked from David's talk, breaking it all down to lists and main points and so on, is, and that I find problematic, is communicating uncertainty. Because when we are approached by the media, we are approached as experts. So experts should know, right? We shouldn't be the ones. I mean, this is how media perceive us, right? And I fully agree. We are the ones that do not know. Everyone else knows everything. And the funny thing is that we, the experts, know the least, right? We have the most questions arising. So it's funny how this is turned around, and one can just hope that people are ready to listen to that, and that media can understand that and not push us into making claims that we really are not at all certain about. So so much from my side for now.
Thank you so much, Maya. Thank you very much for that summary and for raising some really important points. I think there's what I'll try to do now as we move into a broader discussion is just to bunch together some of the points that each of you has made, and perhaps throw some of those at David. I think it's really, Maya made a really important point there at the end about the quality of the data and how that's gathered, and understanding how that data is gathered before you even start to communicate it to the public. I think there's been, certainly in the UK, the public has, there's been a growing sophistication in the public's understanding. We shouldn't underestimate the public. And actually watching, as a former journalist, watching my colleagues struggle with communicating, there's been quite a revolution in that sphere too, with a half-hour news programme on Sky News dedicated to 3 science experts, which would have been unheard of 10 years ago, with science scraping through. So David, I wonder if you would like to address this point that Maya has raised, and a couple of other of our speakers, about the quality of the data as it's gathered. And I know you feel strongly that we can do that better perhaps in the future. Are there lessons to be learned from how that data is gathered and how that happens differently in different countries?
Yeah, I mean, I think these 2 points are connected. The idea that you know, the dangers of sharing data and it being misinterpreted because it doesn't mean what people think it might mean, and the acknowledgement of uncertainty that Maya brought up. And these are terribly important. And, you know, what this is, of course, is just being, I think, trustworthy about the limitations in this evidence, the fact that we don't know. And as I said, things have improved in Britain about, for example, the government are open now and saying they don't know what the effect of schools opening will be. And we're going to try it and see. So, and that's taken a year for them to get to that stage of admitting that uncertainty. We do real research on this, and our research strongly suggests that if you are open about your uncertainty as an expert, then you do not lose trust on the whole. If you can be, in a sense, confident about your uncertainty, saying, well, look, no, we don't. You start by saying what you do know, but then you admit what you don't know, and that doesn't, you can do it. And I know the media at first expect you to know everything, and you just have to fight that, I think, and just say, I don't know. Just come on, I do not know, and make a joke out of it. You know, I do know, I just joke. You must be joking, I don't know. And that goes down very well. I think when it comes to the community, we've got some wonderful experts here about who are actually doing the communication with the statistics. I'm humbled by the skills here, and I think rather than I don't like the idea of holding things back because people might misunderstand them. I think there is a duty to be open and transparent, but with the full knowledge of that people might misinterpret it. And that's why I really believe in testing with audiences, understanding their misunderstandings they might have, and preempting them. Again, the pre-bunking, preempting misunderstandings. So you can say, this does not mean X. You know, in the communication, the countering the misunderstandings is integral to it. You know, like I think on the ONS graph, actually putting little labels saying this does not mean something, you know, warnings about don't take too much notice of the last week's data, it will change, for example, on the graph. And so giving those helpful hints as part of the communication because of knowing how people can get it wrong. And this is difficult, and I think this is a new skill that we as statisticians are having to learn, that it's not enough just to produce the information. We have to take some responsibility for how it is understood and what its impact is. But I kind of, maybe I'm just optimistic or idealistic. I do believe that in the end, we should make things available, even if it's not perfect. But then we really make the warnings and the caveats and this, you know, the limitations really upfront, really upfront.
Can I at this point invite Andres to come back? I mean, I know you raised this point, didn't you, Andres, about whether or not it's advisable to withhold some data until you're absolutely certain. What do you think about David's perspective there?
Yes, thank you. Actually, I wanted to come back myself. But by the way, Susan, Andrzej is a perfect pronunciation. Well, if you may. Okay. Thank you.
Good, I'm glad.
Well, coming back, I just go straight to what David said. But first of all, let's look at the statisticians' work, which I admire, because I do not know anything of that. It's like magic to me. So I admire what you guys can produce out the theories, looking just at the numbers. Well, it's much beyond my comprehension. So it's really something that I look at. In the medieval ages, you were looking at the miracles occurring around. So for me, it's the statistics right now just appearing like that. But I was just wondering that, you know, it's very important to remember that the output can never be better than the input. When you have data that have been played with and you work on them, so your output will be biased, not because of you yourself, but because of those who brought you the data. Let's say that the government wants to show that the number of the new infections, newly infected, is increasing. So what should they do? Just put 10,000 more tests on the street a day before, and they will have more pluses. Well, when you make 10,000 or 20,000 or 50,000 tests more, it's 100% sure you will have many more. And if you do not present the data as per million or per 100,000, you just say, okay, we are getting worse because we have 2,000 more new infections that we used to have 2 days ago. I'm saying this because a very nice comment just appeared on the chat before you, Susan, asked me the question. So how to deal with all the data that we expect that they're around, especially those people who remain asymptomatic, who never been tested. But we know, well, it's 20–25% of them. It's just guessing. We don't know much. We can check it afterwards. So when we do the ELISA tests or whatever antibody tests afterwards, 2, 4, 6, 8 weeks after, and we see that they have antibodies, especially IgM or IgG, so we say that they've been through an infection, or at least they have had contact with the virus. But it does not appear with the data, within the data. So again, the data, actually I'll pose a question. What to do to have the input data good enough to have very reliable output data that we present, that we comment, and well, that we put our faces behind?
Thank you, Andrzej, for that challenge. And I will throw that to David, but can I add something into this as we go, which is Maya's point there about her COVID tracker, COVID-19 tracker that was set up. And we do have a similar non-governmental tracker here in the UK called the Zoe app, which is a King's College London app on your phone, which allows the King's College researchers to gather a different set of data. And I wonder, David, if you would like to reflect on those sorts of public apps, the quality of data and how it's gathered, and address Andrzej's point at the same time.
Okay. Just briefly on the COVID tracker, I mean, this follows the US model as well, essentially a group of volunteers getting together to produce the COVID tracker, which ends up being better than what was being produced by the government. And I think that the ability to harness essentially that community expertise, that volunteer nature is extraordinarily powerful, and it's one of the signs of modern communications and the internet. So I would welcome that. I think and as Sarah said, and we've got this app that 4 or 5 million people have downloaded and putting the symptoms in, and actually it's very good. He's coming up with some good numbers, and it's a totally independent source and incredibly up to date. So I think these multiple sources are quite valuable. And I'm afraid I've got to disagree. We cannot wait for perfect data. I just don't think we can do it. Now, we don't want to pretend that bad data is perfect, but I don't think we can. That's why I wanted to illustrate the fact that currently in the UK, at least 3, there's more, there's actually 6 different definitions of deaths are being used and being made public. I mean, and it's, you think, whoa, this is quite complicated, and none of them are right. so we cannot. I like death registration data. It's not perfect. It missed 10,000 cases in the first wave in the UK. So we could use excess death data. That's not perfect either, because excess to what? What's our comparator? I like excess deaths to compare countries and so on. We cannot wait for perfect data. So we have to do the best with what we can. I think having multiple teams, multiple groups looking at it. One of the things I like in the UK, we've got an estimate of R that comes out. There's 8 independent teams doing that, and all with different models, all coming up with different answers. And then they get together and they agree. This committee decides what R is. I mean, it seems extraordinary, but as a process of argument almost. So I think that it is a shame. It would be lovely to. No, I think it's also part of the education to the public that data is not perfect. It gives you an image. It doesn't tell you what to do. It just gives you some information, and we need some care and thought to interpret it. This is not some automatic God-given truth that comes down. And we've had to educate the media about that. And I think they've learned now to some extent. And the public, I think the public, I wish I could measure this, but I'd love to know what other people's feelings is. But I think the public have got a more sophisticated sense of data literacy now, certainly of scientific literacy, than they started with. I think, people realize that scientists disagree, that science is uncertain, we don't know. Also, that it can do amazing things at great speed. I'm thinking, of both the vaccine and the genomic testing. It's quite extraordinary. So anyway, I'll stop now. But I'd love to know people's opinions on this, because this is such a good panel. Honestly, I wish we were all sitting around in the pub.
Thank you, David. Thank you, David. An incredibly important point there that I think that David has just made about just the steep learning curve that all the various sectors have been on in the last 12 months, and how everybody's perspectives have changed and the learning that has gone on. I just would like to ask if Florina, Andrew Mayek or Ivan would like to reflect on any of the points we've raised so far. I haven't seen any hands waving, but here we are. Good. Florina, please do come in.
Well, one of the points I would like to comment is what you mentioned before about the audience. Which audience do we address? Because I am a scientist, and as a scientist, I many times had to talk to the press and to explain why the vaccine is working in one way, why the immune response is in one way. Is it really necessary for the public, the general public, to know all these mechanisms? Because I'm wasting a lot of time in trying to explain so that everybody can understand. It's very, very difficult for us, and to tell them about the gene sequences which are mutated and why is this important for the virus to infect the cell and so on. So this is one question which was raised before. Is it really necessary to explain everything to the general public, to communicate? These are not data, are not things that the public should know, I suppose.
Thank you, Florina. Very important point. And I think David touched on something which has been a good learning point in the UK, which is it can be a tremendous pressure on a limited pool of scientists who are battling with every question from journalists, especially as you're dealing with a frontline situation at the same time. And the Science Media Centre that was mentioned by David is an attempt to deal with that onslaught or tsunami of questions, if you like. But David, do you want to reflect further there on Florina's question?
Well, except to say I'm so embarrassed. I don't understand at all about the different vaccines, and frankly, I haven't spent much effort to find out. I'm embarrassed. I'm not proud of that, but I actually, agree. I'm not sure how much of that detailed scientific knowledge actually, how important that is. I'd much rather people understood about what is important to them, I think, which is what the risks are in the community, and maybe and what the numbers are doing, what's happening in the country, and so on. But I would say that it's because I'm a very bad scientist. So that's my very, very personal opinion.
Thank you, David. And personally, I know not everyone's like me, but personally, I want to know everything about vaccines. And also, if you don't know about the vaccine, I can recommend, David, our first dialogue is recorded and available, and that will bring you up to speed very quickly. But I have had, so Carole, did you want to come in at this point? Carole Mundell?
Yeah, thanks. I'd like to build on that. And I've been watching this really evolving over the last 12 months. And I think it's thinking about who you're communicating with and how you're building the trust. And I think it goes very much to David's point about demonstrating trustworthiness. So you're absolutely right that sometimes people can have an overload of detail. And I think we see this in children when they ask questions. At some point when they're very young, you give them information and then they go and play with their toys because they've had enough information and they feel quite happy and they go and start playing again. And I think that's a very human reaction. So I think if we're absolutely swamped with information, what happens is we get confused and we think, well, I just wanted to know whether I can go out for a meal safely or not. But then on the other hand, the fact that we are willing to be transparent and explain how things work again up to the limits of our knowledge, and what work we're doing to move that knowledge on. That's a really powerful thing. So working in government, you know, if I can deploy a world-leading expert scientist like yourself in a way that helps me with that communication that doesn't impact on your workload, then I think that becomes, you know, a way for me to demonstrate trust to demonstrate that trustworthiness and authenticity and credibility of the people with whom we're working to inform our policy making. So I think it's part of that wider ecosystem of trust. And I certainly find, you know, like David, I'm not a virologist, but I've learned so much by speaking to expert scientists, and I'm thinking, yeah, okay, I get that. I can see how that's moving on. And I think there's a point along that pipeline where you say, you know, I trust the boffins to do clever things. I've got enough information. I see that you're being transparent with your explanation, and I'm happy to let you get on with it. And in terms of the vaccine rollout, I've certainly spoken to, you know, a range of different people, friends and family. And some other things that impact that trust there is not necessarily just understanding how the vaccine works, but trust in your local healthcare providers, the trust in the system to put the logistics in place efficiently. So our armed forces have helped us with those logistics. We trust that they're very good at logistics. We trust our primary care physicians to call us efficiently, and, you know, we go for our appointments. My mum had her vaccine, for example, her first shot, and so I feel really confident that I'm going to go and get mine when I'm called, because she's well and healthy and safe and happy that she had her vaccine. So when the whole system works together, I think that's what builds our confidence in the system. And when our confidence is knocked a little bit, that's when we start to ask for more and more detail until we find our comfort zone again. So you're absolutely right, and I think the SAGE system helps us to give our scientists, our leading expert scientists who are working flat out, a safe space to actually debate with one another and debate their own uncertainties before they then bring that to the next stage and the next stage. And I think that's also really important as we then engage with the wider communication infrastructure that we have, as Susan's described, with the media or our Science Media Centre, or even some of our science museums, which have a really strong pedigree in the wider science communication that we do outside of pandemic with other science areas. So yeah, try and find some other interlocutors who can help you with that and do it in a paced and measured way. But thanks for all your efforts anyway.
Thank you, Carole. So I wonder whether Ivan or Andrew. So Andrew, you have a question or a reflection you would like to make there. Go ahead.
Yeah, thank you very much. Just a short reflection. I've written down the quote from Professor Spiegelhalter: "We cannot wait for perfect data," which is very much true. But in reality, we actually face two extremes. On one hand, we have politicians and journalists that say, okay, give us the data any time of the day and week, and they are perfect holy grail showing us the reality. And there is another extreme that actually says, okay, all your data are actually garbage because there are so many assumptions behind them that we cannot trust them at all. So I really think there needs to be some common understanding of what are the limitations of the data, and I think your approach to actually be transparent, but also be transparent about the limitations of the data, is actually very good advice, probably for all of us. Yeah, thank you.
Thank you, Andrew. Gikas, did you want to come in at that point?
I think the importance of sharing the real limitation of the data, and also some of the limitations will never be cannot be resolved. Like, for example, testing is a voluntary process. You cannot force someone to do a test. And underlying this voluntary process, there are, like, you know, probably I think I got I had the contact, or and I want to be tested, or I had the contact and I don't want to be tested. Both of them go to the different direction, like, because if you get tested, you will not be able to work, for example, and there are people who are working not in a legal way. So there are, like, all of these kind of limitations in the data that cannot be resolved, and there is a strong ethical, I think, bioethical line that we should never pass. We need to explain that to the public, that, you know, there's the ethical line that we have to trust, and the data will never be perfect, and we are doing our best to explain the data, but the data, whatever will happen, will never be perfect. I think that's one of the most important things that we have tried. I have tried also to communicate that, but I think as the pandemic goes on, people have learned, and I think most of the people now accept that you know there are limitations, and we cannot do anything to resolve them.
Thank you, Gikas. David, is there anything, we've sort of come neatly round in a circle back to the point about, in fact, that Maya began with, that you're presented as experts and yet you're having to reflect uncertainty. Before we move on to questions from the audience, is there anything, David, that you would like to add as a final thought here on this roundtable element?
No, there's so much that's come up, and this is all such good points that we're all wrestling with. I'm very interested. I'm now trying to listen to how good experts do express uncertainty in their language. I'm actually, you know, some people are very good at it. Our chief medical officer, Chief Whitty, you listen to him, there's a whole stream of uncertain statements and cautious statements. He never seems to know anything. So he's but he does, and he's very good at it, and he's remained trusted. I think that this is something we can really learn about. That's why I wanted to go back to John Krebs, I think, who's always done it very well. And it's this sort of, it's humility. It's some, you know, rather than trying to, you know, persuade everybody that you are the authority, you know everything. It's the humility to realize you don't know everything, and there's a lot that's not known, and that is part of the communication message. And I think this is as I said, and other people have said, we kind of hope that this will carry on beyond this crisis, and maybe just improve the general level of understanding in society. But I just want to, you know, again, I'm so interested in what people say about sharing information, about the difficulty and the questions that are coming up about where there are still governments and organizations who don't want to share the data and keeping it. And this is, you know, you can tell this is the thing that I try not to take sides, except on this, where I am deeply, as you can feel personally very strongly of the right of the public who are, suffering, but also just sacrificing so much over such a period of time. They have an absolute right to know as far as possible what is going on and why they are having to take these measures. And I believe this is an ethical argument, as people have raised, and so that's the thing I do feel strongly about. So I think you can feel strongly about that without feeling, I'm not going to tell anyone what to do. I don't know what policy one should have. It's not my job, but I can feel strongly about that, I think.
Thank you, David. They're really good points to bring that element of the this evening to a close. And we're now moving on to questions from the audience. And some of the themes we've touched on are raised again in these questions, so we can elaborate a little bit further. I thought you made a very good point there, David, about Chris Whitty, and I do think that he is very well trusted in spite of expressing uncertainty. We even have Chris Whitty t-shirts and Chris Whitty mugs with the next slide please on them from the daily presentations at a fan club, I think. So uncertainty wins you fans. Anyway, our first question from the audience is possibly one for Carole, I think, but anybody else is free to interject, so please do raise your hand so I can see if you'd like to say anything in response to this. So this question is, I would like to know if this recent pandemic has taught us how important it is to set up an official and shared committee for what concerns the translation of scientific data. I've seen a real chaos in some countries of Europe, and could this be addressed by keeping a certain level of quality constantly reviewed?
Yeah, I think the answer would be yes. I've done quite a lot of work this past year speaking to governments around the world about good science advice mechanisms to government. And I think what Sir Patrick Vallance has been very clear throughout this pandemic with us on SAGE is that we provide that science advice with all of the provisos that David so eloquently described, and we then pass that to our policy teams, and the policy teams then make those choices. So, for example, some of the behavioural data that are subcommittee on behaviours gathered helped to inform our Treasury team's policies on how to support families economically through lockdown. So that was another piece of data that had to be gathered. And I think, you know, our SAGE mechanism has been in place in the UK for many, many years. I mean, going back to previous government chief scientific advisors, when the Fukushima nuclear disaster happened, you know, we scrambled the SAGE mechanism. The right sort of experts were in the room to answer the question really about the safety with that nuclear disaster as to what was happening with the radioactivity. That was actually to inform, for example, our policy on whether we needed to evacuate our colleagues from our embassy in Tokyo. And because of that deep piece of scientific research really that was done at pace to address that emergency immediately, and we were able to reassure our staff at posts that actually it was safe, and we had the evidence to do that, and we shared that with other embassies and other colleagues and also local authorities within Japan. And so that was something that was then a force for good. We did that for our, obviously for our own interest, to advise our policy teams, but we were able to share that more widely. So this past year I've certainly been speaking to lots of governments saying, how do you do this? How do you step this up? And what we've learned is having that mechanism embedded in government, because we actually have a network of chief scientific advisors across Whitehall. So Sir Patrick leads a network of chief scientific advisors. We are on secondment from academia, so we are scientists, we understand the scientific method. I'm 3 days a week in this Science Envoy but also science advice role, and I'm 2 days a week back in academia. So I provide a bridge. I also provide a communication translation role almost between policy teams who are civil servants and academics who are deeply into their research. And Sir Patrick can then draw on that CSA network as well as the wider ecosystem to provide that agile science advice. Sometimes, you know, in a very localized way. So a year or so ago, there were floods across the UK. There was a dam that looked as though it might collapse. And so he drew in the right kinds of experts. That didn't need to involve me because I do international work. So to step up a bunch of academics very quickly at a crisis point like a pandemic is a really big thing to do. And we've heard from colleagues on the call today, you know, to actually reorientate your research because the government has phoned you up is also a big thing to do. So I think having that bridging mechanism, that deep science advice mechanism embedded in government that sits with a real humility alongside the policy teams and then can draw into that deeper scientific ecosystem, I think is a really, really powerful and stable mechanism, and also one of credibility when we then advise the public as to why we're taking policy decisions that we are. So yeah, I mean, definitely something that other governments I know are actively looking at around the world.
Thank you, Carole. Okay, so I have one person who'd like to come in, that's David, and then we have a question for Professor Magiokinis after this one. David first.
I'm sorry to butt in, but I agree that this network of scientific advisors has been extremely powerful. But it's not just that. There's a whole ecosystem, which I'm pleased to be part of scientific engagement with policy and with the media and with the public. And this ranges from, I don't know, BBC programmes that are fronted by academics rather than celebrities about science. It deals with this Science Media Centre that provides a join between the scientists and the media. And this all has arisen because of disasters in the past about MMR vaccines and about GM crops, where it's all gone really badly wrong. And this has been very successful, but it's quite a complex system and it also involves having many scientists who are prepared to get media training. Giving statisticians media training so that they can go on the radio, so they know they're not intimidated by being questioned on television, on the radio, and things like that. So it involves a whole movement, I think, within the scientific community that public engagement with policy and with media and with the general public is a vital part of their career, and that they can get career awards for it. That this is also part of the incentive structure for academics. That is not just publications in certain journals, that you can get promoted because of the amount of work you're doing in the public life. And I think so. I think the scientific community also has to examine itself and about helping this.
Thank you, David. Maya, did you want to come in at that point?
Yes, I think this is exactly maybe the problem that we're having in our country, and that's the question. So we are trying to volunteer to help, and we would like to do more, but we would need the government to take some of our usual workload away. Okay, so if we, the academia, are to contribute, we have to be able to put some of the usual work aside, and we have not been able to find a way to do that in our country. So I would be very interested to hear how you do it in your countries.
Okay, well, if anybody would like to comment on that, let me know. In the meantime, I just would like to ask a question from our audience who've been very patiently putting their questions in the Q&A. This is, as I said, a question for Professor Magiokinis, and feel free to draw on knowledge from earlier in the evening and say you don't know if you don't know the answer, of course. So Professor Magiokinis, Greek authorities have never provided essential subnational COVID data, including subnational deaths data, testing data, hospital COVID-19 admissions, ICU occupancy by COVID-19 cases. None of these has been made available to the public in subnational level up to now. Why does that happen in Greece? And would bodies intend to provide open detailed data before the pandemic is over?
Now, the reasons for not providing detailed data for different regions, like for example deaths or testing, that is because like collating all this data is more of there are many difficulties in disentangling this data. For example, some people are being transferred from one region to the other, and like the hospitals, and they have to disentangle in which hospital and where they originated. So for like many people are being transferred in Attica, and like they die in Attica. So there are problems in disentangling exactly at which place each person originated. And because this is the transfer between the region is very intense, there is more noise in the data, like actual information. So for providing subnational, that has been troublesome in being like transparent. This is like my understanding up to now. I think, and also if you look, like Greece is like a very small region to have like subnational data, especially in deaths. That's like, for example, the islands don't have hospitals. Like they do have some hospitals, but most of the people from the islands come to Attica. I think that's the major issue that comes with the data at the level, and it takes a lot of time to disentangle them.
Thank you very much for that. So that does, I hope, reflect some difficulty in the gathering of data there. And again, the point was made earlier about incomplete data sets. Our third question from the audience is for David again, and I think it's on your pet subject actually. What implications does withholding COVID-19 data have on public awareness of coronavirus and so-called individual responsibility in the pandemic?
Ooh, I think I'm sure other people could answer that better than I could.
Would anybody else like to come in?
I mean, I just feel that there is, in order, I mean, it's partly, again, I want to mention that individuals are making such sacrifices. I feel they have a right to see this, regardless of anything else. Just absolutely a right to see the data that affects them. But I'm sure other people could say about the impact on those individuals. They might. I'd like to hear what other people have to say.
So, is anybody keen to come in on that point? Ivan, we haven't heard from you for a while. Maya, there we are. Go ahead, Maya.
Well, I can try, but maybe with a specific example. an example we are seeing at the moment is the problem of the quick tests. Okay, so we know they're not perfect. We know they're quite okay, above 98% specificity, but we know that means a very low positive predictive value in the general population. So we have a lot of general population that has to get tested. For example, if you want to go skiing, you have to go for a test. So we have a population that has no symptoms, so general population, and a lot of people will get a positive test, which will then later turn out to be false positive. And this is something, it's not easy in probability to explain this, that even though the test is good, there's a high chance that when you get a positive test, it's a false positive. And no one has tried to do this in our country. And the result is that now that people get those results, they see, oh my God, I know so many people who were positive, and later it turned out that there was nothing about that. So they get very upset, and this lowers the trust that we talked about earlier. So this is, I think, an example of how the authorities decided not to explain this because it's hard to explain, or for any other reason, and then when it gets out, it is a problem.
Okay, thank you, Maya. I'm just going to ask the next question because it's very closely related to your answer, actually. And then perhaps Carole and Andrew would like to come in. I think you were both raising your hands. So this question from the audience is again about uncertainty, and I wanted to ask, how would you recommend dealing with uncertainty around COVID case numbers, given that there are so many asymptomatic cases and testing certainly doesn't catch everyone? This uncertainty feels like a particular problem when it comes to cross-country comparisons of cumulative case numbers, where the UK and several countries in this region show up, perhaps unfairly, as being at the top of the table. So, Carole, would you like to reflect on that question and also Maya's point there about false positives and public trust?
Yeah, definitely. I think it's part, again, of the whole ecosystem. So a year ago, when the UK was starting to step up its testing regime, the first thing that we had to do was create the test kits. So actually get the assays right, get them matched to the genomic sequence of the virus. And that was done in our government national labs, where we have the capability to do that. And that was a really careful piece of calibration of the tests that were coming through. And we've continued to do that work so that we can have a really detailed understanding of the rates of false positives and false negatives. And actually, we found that as the tests have got better, the false positive rate has dropped to be very low. But you're right, there's also statistical calculation that goes into that. So there's lots of complexity there. I think the other thing to say that, thinking about these tests, when we think of them as a government, we're looking at these statistics, we're talking about the data, the stuff that we've seen David show. But what we also mustn't forget is that there's a person at the heart of that. So there's someone either who's developed symptoms and have gone for a test, or they've been asked to have a test as part of maybe a student going back to a hall of residence. I mean, you get a test that's positive, that will make you feel something. You'll either be afraid, or you'll be confused, or you'll not know what to do with that result. So all of the infrastructure that goes around that, the information that you're given to support you as you go in for that test, an explanation of what that test means and what the system will do to support you there. So for example, if you have a quick lateral flow test and then it's followed up with a lab test, you need to be very clear with the communication even at that point. Okay, if you get a positive at this point, don't worry, go home immediately and self-isolate, but there'll be a phone call in a couple of days for us to confirm whether it's a true positive. For example, that's a hypothetical case. So I think the communication all the way along, making it person-centered, is incredibly important to empower each individual. And think of yourself if you were in those shoes. What do you do with the information that you've now been given? And this is something that's laid down very robustly in all of our medical systems. Whatever you're being tested for, when you get information, what do you then want the person to do with that? So I think that goes to the heart of what data are for, and who they're for, and how you then digest and internalize them and act on them. So that's very important to start with. And that's also very important for helping people when they do get a positive test to understand what they now need to do. That means go home immediately, and that's now enshrined enshrined in UK law. It doesn't mean go via a relative to tell them that you've got a positive test and then go do your shopping and maybe, you know, meet your granny. It means do exactly what we're telling you to do, and you now understand why, but also what support we'll give you and what medical support is there if you start to feel increasingly unwell. So you have to give people those instruments of control. And then I think that that broader piece of you know, the whole decision-making process. I'm sorry, Susan, you can just remind me of that last piece of the question. I think I've forgotten the second part that you asked me to answer on, because it was related to that.
Yes, well, we're talking about international comparisons between countries and whether the UK comes up at the top unfairly, perhaps because it does well.
Yeah. So this is a really important thing and something that I've been working with colleagues on international comparators, because this is something that we've all been doing. And the UK obviously was initially looking to learn from other countries as we were trying to build up our capacity. So again, I think this goes back down to the provenance of the data and what are you gathering? What do the data mean? Right through to if you've got genomics data, there's no point just having a genetic sequence if you actually don't know what then happened to the patient that you've gathered that sequence from, for example. So the metadata are very important. The ethics around how we store those data, the privacy, patient privacy, and all those sorts of things. So the international comparators are really hard. And I think this is where all of these wonderful tools that we have online, any of us can go and find one of these comparators, plot the normalized deaths per head of population or whatever, and see where our countries sit. Those tools are wonderfully empowering, but of course you can't use them without intelligence and without background knowledge. So they should also come with a bit of a cautionary label on them. And you know, I think Professor Chris Whitty has said this, you know, we will do a tally of this some years down the line. First of all, because of the way we gather and store and curate the data, but also because we still don't yet know the full impact of this disease. And we're seeing, you know, people coming through who are developing long-term health problems, I think called long COVID. And we may yet be gathering the data long-term to understand what the full implications are in terms of deaths, for example. So I think putting in the surveillance systems, putting in the infrastructure now to gather the data, tag it, put all the metadata with it, curate it so that years down the line, we will be able to do an assessment. And also scientists in the future will be able to analyse this pandemic to arm them for future disease and future pandemics. Thanks.
Thank you, Carole. I know Andrew would like to come in. Andrew.
Thank you very much, Susan. Well, here there are two questions actually. The first was, let's say, about the openness, or whether there may be some reasons not actually to disclose some data. Well, we need to take into account that sometimes actually the official institutes operate under quite a strict legal environment, and sometimes it's not so easy. So maybe this is often the reason why some processes might be difficult. The ownership of the data may be more difficult than it looks like. Then there is often, of course, the question of individual privacy. Of course, if microdata, that means patient level data, are under discussion, you really need to take into account whether there is not some risk of privacy breach when disclosing those data, even if they may be useful for data scientists, for example, to use. And then you really need to think about how to make those data still useful, but safe from potential privacy breaches. And then the question that was also discussed, for example, the smaller areas and data for such areas. It's very true that such data can be very noisy, and sometimes the information on the residents may be missing. You need to impute that, and there are really many risks of possible errors. But at the same time, those data may actually be useful for decision makers at the regional and municipal levels. So I think sometimes you may need to consider maybe different levels of access. So some data may be available for wide public, some data may be available for scientific institutes under some formal request, and some data may be available for example, for local decision makers. And this is we try to actually establish something like that, to have different levels of open data with different accessibility, let's say, and some of them with higher risk of bias, let's say, is only available for those more restricted groups. The second question was actually about the so-called ascertainment rate. So how much those cases we see in the statistics, how much they really represent the infection rate in the population. And it is quite clear that it's not like the reality that we would see the whole picture of the infectious individuals. And as actual ascertainment rate, that means the proportion of what we see is, to be honest, quite difficult to state exactly. So we need to definitely take into account such kind of bias and only interpret those trends taking into account that there is hidden or less hidden assumption that the testing policy is actually consistent. If you change the testing policy, there is a break in the time series and you cannot compare anything. This is quite important to consider when you look at those data.
Thank you very much, Andrew. David, you raised your hand there, and I wonder, by all means, do make your point, but I wonder also if you could pick up on a point that was raised in this earlier discussion about the quality of data going forward and how we make sure that it's tagged well, or Carole's point, really, just as we come to close, to make sure we do cover that. I think it's very important. David.
Yeah. A few quick things, and I've now forgotten what was the last point. I was going to butt in there and say something. Oh, I know. Three quick things. The first thing is, it is so important, and one of the things I'm really proud of that the Office for National Statistics has been doing is a random survey, essentially a population-based survey of which has been incredibly important to work out in an unbiased way what is the underlying prevalence of the disease and to estimate an incidence. It's only by doing that we can calibrate the numbers we're hearing every day. So roughly speaking, I know whatever we hear at the moment, you just double it, and that's very roughly the number of new cases. But as you said, if the testing policy changes towards, you know, a huge number of lateral flow tests being done on asymptomatic people, then that will change as well. On the testing, it's amazing. I mean, Carole's quite right. You know, what people are being told now is much better, but because the stuff at the beginning was terrible. People they would get a test and they'd say, "Oh, that means you're positive or negative." No. In low, as we heard from Mina, in a low prevalence situation, it's highly likely that a positive result will be a false positive if it's rare enough. That changes with the prevalence, and also with a lateral flow test, if it's positive, it doesn't mean you're positive, and if it's negative, it doesn't mean you're negative. So, you know, people need to be told this, that it's evidence, but it's not absolutely correct. And so that expression of uncertainty at a personal level, I think, is a major innovation and a major maturing of the communication between the authority and the individual. And I think it's a very positive step indeed. The final thing on just going forward with data, this has been an enormous wake-up call to the entire data structures, data handling for every country. And Britain, in some ways, we've done quite well. In other ways, it's really shown up the problems. First of all, we're 4 different countries with 4 different organisations, 4 different definitions of what a COVID death was. And now we're roughly the same, but it was different between England and Scotland, for example. And so just that's complicated enough. But even within England, you've got different organisations with different data ownerships. They haven't been working well together. Our health data needs a massive review in order to make it much more fit for purpose. It's been a real struggle to do the sort of linkage and the bringing together, as you've all discussed. It's worked just about now, but it really needs a huge review. And so I do think that in so many ways we have to make the most of this pandemic in order to learn its lessons and to produce structural changes in the way data is collected, brought together, curated and used in policy and made available to the public I believe that should be the default unless there's a good reason not to. The open data should be there unless there's a good reason not to. And it shouldn't be held back because, oh, people might not understand it or people might not use it properly. That is just an excuse for trying to keep the public ignorant of what's going on.
Thank you, David. Well, that was a very good and timely, almost closing statement. We have just a couple of minutes left if anybody, and we've covered most of the points in the questions that have come through on the chat. So if anyone of any of our speakers on the panel would like to make a final point, you have a little bit of time to do so. Andras, are you raising your hand?
Yes, I actually I was. You know, looking from my point of view, or from the point of view of my country, where the short story for the past 50 years is not to trust the government, is even worse when you have now the government presenting the data that are crucial for your life and for the nearest future, as well as for the furthermost future. So when the first thing is to not to trust, because this data is being published by the government, so it cannot be 100% certain. Oh, we've been taught it for 50 years, over 50 years, as many of my colleagues present here were too. So at this point, I think that this makes a game bilateral. We do not trust what they're saying. They don't say anything because they know we wouldn't trust it. So it's even more complicated when we're talking about, and this, David, I thank you for giving this as a final remark, because to change the way of data strains collecting is the thing that we've been trying to do for the past 10 years, which didn't necessarily work. And I really do think that after seeing how unnecessary, how useless many of the collected data really are, we learned during the pandemics. And the reorganization can bring in two important effects. First of all, we'll have better data, which is obvious. And secondly, if they are gathered right, and if they are being sent to, like you have in Great Britain, 8 independent places to be analyzed, and then these guys, well, thanks God they don't give 8 different communications, but they meet together and they say what the right thing is. Well, this would probably also raise the blame from the government, because this wouldn't be already data signed by the government, by official agency, well, creating what you advise, independent analysis of the data and independent collection of the data would be the thing, I think, that at least in Poland could change a lot in the future. And if any, this could be possibly one of the good leftovers after the pandemics. If there's any, thank you.
Really, really great closing point there. Openness, transparency, trustworthiness, dealing with misinformation. We've covered so much ground this evening. Unfortunately, we have reached the end of our 2 hours. It's been incredibly lively and productive. And thank you to everybody who's taken part, all our speakers, our keynote speaker as well, and to Carole and to the audience for their lively questions. I will now draw the event to a close and just invite everybody to join us for our third dialogue on the 9th of March. In the meantime, though, thank you to everybody. It's been really fascinating and really interesting.
Thank you.
Goodbye. Thank you.